Sexual assault of men and boys. Anyone can face sexual assault, no matter what their age, gender identity, or sexual orientation. According to CDC, 1 in 3 men have experienced sexual violence involving physical contact during their lifetimes. About 1 in 26 men have experienced attempted or completed rape. Bossel K.C., Smith S.G., Krasno M., Kadiwata S., and Limas R.W., 2022. The National Intimate Partner and Sexual Violence Survey, 2016-2017 report on sexual violence. Atlanta, GA, National Center for Injury Prevention and Control, Centers for Disease Control and Prevention. Men and boys who have been sexually harassed or assaulted have the same reactions and emotions as other survivors of sexual harassment, assault. Unfortunately, they face some additional challenges because of stereotypes and social behaviors about men and their masculinity. Men, boys, who have survived sexual harassment, assault as adults feel self-doubt, shame, thinking they are not strong enough to fight back. Many men were confused about their behavior and wondered what this meant. Men, boys need to understand and must be educated that any kind of normal physiological response does not in any way imply that they wanted, enjoyed, or invited the harassment, assault. Men who were sexually harassed, abused as teenagers or boys respond differently as compared to men who were sexually assaulted as adults. Some common experiences shared by sexual assault survivors, both men and boys, are anxiety, depression, post-traumatic disorders, flashbacks, eating disorders, social anxiety, avoiding places and individuals that remind them of abuse or assault, concerns about sexual orientation, fear of worst, fear of having a shortened future, feeling like less of a man, the feeling of no longer having control over your own body, feeling on edge, unable to relax, difficulty sleeping, sense of shame or blame over not being able to stop the assault, especially if they experience normal physiological reaction, withdrawal from relationships, withdrawal from friendships, and increased isolation, worrying about disclosing for fear of judgment, disbelief. Perpetrators can be of any age, gender, or sexual orientation. They can have any relationship to the victim. Like all perpetrators, they use psychological and emotional tactics. Some men and boys question their sexuality after surviving a sexual, and that's very understandable. This is especially more concerning if they experienced physiological responses during the assault to them. It means they have no control over them, and this confuses them. Moreover, some perpetrators, especially adults who sexually assault boys, will use physiological responses to maintain secrecy by using terms like, "You know you liked it,"